Caffeine is a stimulant that is found in many foods and drinks, including coffee, tea, soda, chocolate, and energy drinks. The amount of caffeine that is considered too much can vary from person to person, but a general rule of thumb is that adults should not consume more than 400 mg of caffeine per day. This is equivalent to about 4 cups of coffee or 8 cups of tea. Some of the side effects of too much caffeine can include increased heart rate. Caffeine is a stimulant that can cause your heart to beat faster. High doses of caffeine can lead to palpitations or irregular heartbeats. Anxiety and restlessness. Caffeine can stimulate the central nervous system and increase alertness. However, excessive amounts can result in feelings of anxiety, nervousness, jitters, and restlessness. Dizziness. Caffeine can also cause dizziness, especially if you consume too much of it too quickly. This is because caffeine can increase your heart rate and blood pressure, which can lead to a feeling of lightheadedness. Insomnia. Consuming large quantities of caffeine, especially close to bedtime, can interfere with sleep and contribute to insomnia. Caffeine's stimulating effects can make it difficult to fall asleep and may reduce the overall quality of sleep. Upset stomach. Caffeine can also cause an upset stomach in some people. This is because caffeine can irritate the lining of the stomach. Gastrointestinal issues. Caffeine can act as a diuretic, promoting urine production, which may increase the frequency of urination. It can also lead to increased bowel movements, potentially causing diarrhea or loose stools in some individuals. Chest pain. Caffeine can cause chest pain in some people. This is because caffeine can increase the heart rate and blood pressure, which can put a strain on the heart. Headaches. While caffeine can provide temporary relief for headaches for some individuals, excessive consumption or sudden withdrawal can trigger headaches and migraines in others. Dehydration. Caffeine has a mild diuretic effect, which means it can increase urine output and potentially contribute to dehydration if not adequately balanced with fluid intake. Increased blood pressure. Caffeine can temporarily elevate blood pressure, especially in individuals who are sensitive to its effects. If you have high blood pressure or cardiovascular conditions, it's important to monitor your caffeine intake. Dependency and withdrawal symptoms. Regularly consuming large amounts of caffeine can lead to dependency, resulting in withdrawal symptoms when you try to cut back or stop. These symptoms can include fatigue, irritability, difficulty concentrating, and headaches. In rare cases, very high doses of caffeine can lead to more serious side effects, such as seizures, heart arrhythmias, and even death. If you find that you are experiencing any of the side effects of too much caffeine, it is important to reduce your intake. You can do this by cutting back on the amount of caffeine-containing foods and drinks that you consume, or by switching to decaffeinated versions.